Currently, I'm in the Ivory Coast in an area called Catiola, and it's an emergency obstetric project for women and newborns, and it's a project jointly with the Ministry of Health in order to support and raise the standard of care. It was a case of obstructed labor in the setting of a previous cesarean section in a very young woman who was from a village far from Catiola. Unfortunately, she had received traditional oxytocin, which we don't quite know what it involves, but certainly it makes contractions stronger, makes labor go more quickly. But unfortunately, when you have a scar on the uterus, it also exposes you to severe complications. In this case, rupture of the uterus, which is in fact what happened. It can be catastrophic for both mother and baby. She arrived exactly in the last possible moment. She had a uterine rupture and the baby was in a quite bad state, requiring resuscitation by the pediatrician. Now she and the baby are recovering. She did quite well with the surgery. We were able to repair the uterus because the alternative is to remove the uterus, which sometimes we have to do in catastrophic situations. She required multiple blood transfusions, intensive care follow-up after surgery, and the baby remains in the neonatal ICU for critical care. So she is indeed the category of people that we are here to serve, who require our services in the operating room, in the blood bank, and the post-operative care. Certainly, if this hospital did not exist and the services in it did not exist, she would have died, as would have the baby. Because in this situation, what you need is 24 hours of operating room and blood bank with the staff that can operate them, and that's what we have here.